topic we will be discussing about ethics in public relations and public relations law in healthcare industry. Public relations in a medical center or in a hospital helps the hospital authorities to manage relations with various patients, patient groups and healthcare authorities. When we talk about ethics in healthcare industry, the first thing which comes to our mind is code of ethics. These ethics are followed in the industry and set a base as principles and rules that are being used by companies, healthcare professionals, professional organizations, individuals and non-government organizations to govern the decision making between what is wrong and what is right in healthcare industry. There are 4 basic principles which are prevalent in healthcare industry, and these principles are integrity, which means honesty to which the work is being done, objectivity, which means open-mindedness to achieve the target, confidentiality and competency, which means having desired skills to perform the task. When we look towards the international scenario of code of ethics, there are certain international codes which have been prescribed by World Health Organization which are prevalent in healthcare industry, and these codes are professional conduct, being uninfluenced by profit, cautions, certification and justification of ethical codes, loyalty and secrecy of the employees towards the organization and towards the patient as well. Societal codes. These societal codes are established by various businesses as a part of their social responsibility program, and these societal codes are personalized towards their respective company environment. There are 4 codes which are prevalent in societal codes. Reliability, which means codes should be accepted by all. Impartiality, which means codes should not favor any individual or organization. Discretion, which means codes should be detached. And proficiency, which means the individuals who are performing the task should be skilled and well equipped to perform their task. For there is example, like in England, England healthcare industry has set certain norms of conduct for healthcare support professionals and adult healthcare workers who are working. These codes comfort the patients in England that they are being provided with the best possible healthcare industry in safe and compassionate manner with high standards. Professional codes. These codes are established by the companies for their own employees, and these codes are that the employees should be unbiased, they should be fair in their judgment, they should have genuine concern towards their patient, and they should be efficient in performing their task. For example, Washington Healthcare Hospital System is committed towards excellence in patient care, education training, research and stewardship towards district resources. The entire staff of the hospital, which includes board of directors, employees, members of medical board, volunteers, contract workers, students, instructors are expected to adhere to the code of professional conduct in all their interaction with their patient and their wards. There are various laws which are also prevalent in healthcare industry, and these laws are law of defamation, invasion of privacy, copyright and trademark laws, internet copyright issues, trademark laws, and miscommunication. We will take one example of defamation. In 2005, Shamshaw Medical Hospital Center in New Rochelle and Mount Vernon Hospital in New York agreed to pay a patient $2.3 million when an attorney fought a case of a patient where he said that the patient was being overcharged on the drug which has been administered. As per US laws, while administering any physical drug, no physician or hospital is allowed to make extra charge while he is administering any drug on the patient. There are certain challenges to ethical behavior, and these challenges are utilitarian view of ethics, which means setting tone for the best moral action, and these actions are judged on ethical and unethical on the basis of consequences that happen to others. Action that maximize the goods are preferred. Individual view of ethics, which means that they are setting the tone for the moral action, and individual ethical decision making involves 4 aspects, that is ethical issue recognition, ethical judgment, ethical intent and ethical behavior. Justice Then there is moral right view of ethics, which says that morality towards the justice, which means that no one should interfere with other person's right, and justice view of ethics, which means actions are judged on as ethical or unethical on the basis of fairness shown to those who are affected by the treatment. There are certain ethical dilemmas also which are prevalent in healthcare industry, and these dilemmas are discrimination, sexual harassment, conflict of interest, consumer confidence, and organizational resources. With this, we come to the end of this chapter. Thank you.